Chronic kidney disease is a progressive condition in which kidneys don't work properly as they should in order to filter waste, toxins, and fluids from our body, which can cause serious health problems. Earlier detection of chronic kidney diseases, that is commonly known as CKD, could slow progression, prevent complications, and even reduce cardiovascular related outcomes. We at Medicircle are conducting a World Kidney Day awareness series featuring eminent nephrologists and urologists from different healthcare organizations to get their views on maintaining good kidney health. Hi, I'm Smita Kumar, your host, and today in our Doctors Speak show, we welcome Dr. Kiran Chandra Petro. Dr. Kiran is a senior consultant nephrologist at NU hospitals. He has been associated with the field of nephrology for more than a decade. He has presented various papers, and most papers have been awarded. He has published in various well-known peer-reviewed journals and authored chapters in books. Dr. Kiran has a keen interest in educating the general public regarding renal disease and is associated with various media presentations and interactions. Hello, Dr. Kiran. Welcome to Medicircle.
Hello.
So, Dr. Kiran, to begin with, what are the symptoms of an unhealthy kidney and how should one react to the same?
So unhealthy kidneys normally they present with very vague symptoms. So it's not a clear-cut demarcation that a kidney disease has these particular symptoms unless there is swelling of feet, decrease in urine output or blood in urine, facial puffiness, breathlessness. So these are the things which they can present with in general. So in chronic kidney disease, initially the symptoms may be very, very minimal and the symptoms start occurring late in the disease in some of the courses, and hence there is a need to go in for regular health checks, especially if they are having any risk factors, that is diabetes, hypertension, or any heart problems or any other associated illnesses like kidney stones.
Okay. So in lot of patients, it has been seen like these patients who are suffering from hypertension or diabetes, they actually lead to more CKD diseases, like the chronic diseases of kidney are more common. So what might be the reason? Like people say that diabetes is a silent killer. Even my mother, who was a diabetic patient, she later on developed CKD, and that was one of the reasons of her sad demise. So what are the reasons, like if like diabetic patients, if they're not taking care of their kidney properly, can it lead to the CKD or chronic diseases or kidney failures?
Yes, the commonest cause of chronic kidney disease, not only in India but in the whole world, is diabetes. And this is a very silent killer, as you put it across rightly. Diabetes per se does not present with any symptoms of diabetes per se unless you are having very high or fluctuating sugars. So diabetes affects each and every part of our body because it affects the small vessels. So the vessels in the eyes, the vessels going to the kidney, vessels going to the heart, vessels going to the nerves, these are all affected. And because there is an effect of all these particular organs, these organs are the ones which get involved. So they develop diabetic retinopathy, diabetic nephropathy, diabetic neuropathy. So similarly, as they are developing all these particular processes of diseases which are conglomerate in diabetes per se, so they do not really say that diabetes alone is the cause, so they do not really identify it. So these diabetics, whoever is having diabetes, have to be under regular follow-up to take care of diabetes, because that is the only thing which can definitely be controlled. Because you take medications for diabetes and you control the diabetes, then the progression of these diseases can be halted to some extent, though we cannot truly stop any of these diseases once they set in. So chronic kidney disease, similarly, when it starts off, so it starts mainly like protein leak. So the urine will show protein leak in diabetics. So these people may not have any symptoms during that particular phase. And when it is really picked up, then that is when we can really halt the progression of the disease, because that is where you can give medications to decrease the protein leak in them.
So as you are discussing the different factors, I like one of them are these lifestyle diseases. What are the other factors that cause kidney disease, especially kidney failure?
Right. See, chronic kidney disease is actually very common among general public, but it doesn't mean that everybody lands upon the stage of dialysis. So we have around 1.5 to 2 lakhs undergoing dialysis presently in India. So all these things which occur and they lead to dialysis requirement is when there is end stage kidney disease. That means the kidney is damaged totally. So non-modifiable and modifiable risk factors, if you really look into the diseases which are like diabetes, hypertension, obesity, all these can lead to kidney problems. The main things which can be modified are usage of painkillers. People take the painkillers over the counter without actually having a prescription, because if they have even a headache or pain in the back or low backache or a dental pain, so they go ahead and start taking painkillers. So long term usage of painkillers or even a single medication of painkiller can cause kidney damage. Then any of the stone diseases, if they are causing obstruction, if the stone is inside the kidney, it may not cause any problem, but once it comes into the tubes, it can cause problems to the kidney function. Similarly, prostate, if it is left alone, not getting treated on time properly, or if there are any other glomerular diseases, like there are some chronic glomerulonephritis or interstitial nephritis, or like reflux disease. Commonest problem for chronic kidney disease in children is reflux disease. So these people grow into adults and develop chronic kidney disease and end stage renal dysfunction. So these are the few of the factors which can lead to kidney diseases.
And Dr. Chandra, once the kidney failure has been done in the patient, is dialysis the only solution?
If we are talking about end stage renal disease, yes, because end stage renal disease indicates that there is no kidney. So the kidney has reached its end. So it is as good as no function. So when there is no function, you still have dialysis to go about, which is a supportive care. That means it gives only support. It is as good as somebody whose leg is cut and fallen off or amputated. So in such a situation, you wear an artificial limb to take care of the needs. Similarly, dialysis is nothing but an artificial kidney. So it takes care of the needs of the body. The excretion of the various products are taken care by dialysis during this particular period of time. So dialysis is only a temporary process. It's not a permanent cure for the disease, and it has to be an ongoing process, and it has to be maintained over a period of time. If it is hemodialysis, it should be done thrice a week. And if it is peritoneal dialysis, then as per the orders which are being followed on a daily basis.
Okay. So what is a peritoneal dialysis? Because I have only heard of hemodialysis, which is like a dialyzer is there and there is a fistula which is there added in the arm, and then there is a blood which is coming out and it purifies the body.
True.
One
So
take
there
that
are two
out.
different ways of doing this purification. So the main purification which you already discussed is hemodialysis. Hemodialysis is nothing but blood dialysis, where our blood is taken out, purified, and put back. So it is either through the fistula or through a catheter which is put into the blood vessels, so that the blood can be drawn out easily, purified, and sent back. So this has to be done thrice a week. And a peritoneal dialysis is nothing but a home dialysis. Peritoneum is an abdominal cavity covering. So you put a catheter into the abdomen and you put fluid into the abdomen, and after few hours, that is 4 hours, you remove the fluid out. This is a manual method, and there is also an automated method where the machine is there. So you connect the catheter to the machine and you can leave it overnight, so that the dialysis will keep going on and the machine does the work for you, where it will fill in the abdomen with fluid, and then after some time it will remove out the fluid or the waste product. So when after 4 hours, when you let out the fluid in manual method, that particular fluid will be containing all the waste which are accumulated in the body, and similar to our urination, you are removing out the waste product. So this has to be done, if it is done manually, at least 3 to 4 times a day. And if it is done with an automated peritoneal dialysis, that is with a machine, that is done through the night for the 12 hours.
Okay. So, Dr. Chandra, as lot of patients are, I mean, afraid to go to hospitals due to COVID infections. And in COVID times, these dialysis patients have been hit hard. Those who were having home dialysis facilities were still able to, maintain all these dialysis procedures. But what is your suggestion in such a case when the patient is actually not able to visit a hospital for a dialysis?
No, in coronavirus disease also they have been visiting the hospitals because they have no choice. That is an unfortunate problem for them, because without hemodialysis, then the life is at risk. They develop symptoms, become breathless. They have to admit into the intensive care units. So this is the problem. So unfortunately for them, they have no choice but to come for hemodialysis on regular basis. So all the hemodialysis centers in the country have been following protocols to keep them isolated so that they don't get infections, nor do they give the infections to the technicians or the doctors who are treating them. So taking care of all these factors, they have been undergoing hemodialysis, and luckily now that the vaccination is also out, the vaccine also can help to some extent. Though what we need to really understand is vaccination is only a part. Our social distancing, mask and hand hygiene is most important and should be followed very clearly.
Definitely, definitely. So, Dr. Chandra, what dietary suggestions or lifestyle changes would you like to advise to keep one's kidneys healthy?
Right. So let us talk about normal individuals per se. When normal individuals, you can take your normal way of routine diet. There is no requirement to really cut down anything when you're normal. But when you develop diabetes or hypertension, you have to cut down on your sugars and salt. So when your salt intake and the sugar intake comes down, the rest of the thing, main thing is to cut down on your carbohydrates. So when you're coming down on your carbohydrate and the salt, it takes care of your other portions. So this is in normal individuals. And fluid intake should be adequate. Like so many people recommend around 8 glasses per day and all. But now as you come towards chronic kidney disease, this doesn't hold true. So if they are already fluid overloaded, if you tell them to take as much fluid, they'll not be able to excrete it out because their kidneys are not functioning enough. So we have to restrict fluid in those people who are having fluid, extra fluid in the body or swelling in the body. So in such individuals, the fluid intake has to be restricted, salt intake has to be restricted, and we as Indians are basically vegetarians who also take non-vegetarian. It is not that we are truly non-veg who take thrice a day. So in such a situation, we have to modify the lifestyle where you are not taking excessive protein. So the protein amount which you are taking has to be cut down, especially cut down the red meat and cut down on your extra intake of extra proteins. So the protein intake, especially in kidney patients, should be between zero point 0.6 to zero point 0.8 grams per kg per day. Normal individuals take up to 1 gram per kg per day. So that's how the protein intake has to come down. Salt intake has to come down to 1 teaspoon per day, or approximately 5 grams of salt per day only. Fluid restriction strictly. And all patients who are having chronic kidney disease are advised not to take fruits, fruit juice, coconut water, and especially in Karnataka and other places, ragi, that is those millets which are taken, which contain a lot of potassium. So all potassium containing items have also to be restricted in these people. And in patients who are only having mild to mild diseases, then they have to avoid even using painkillers so as to avoid progression of the kidney disease. And always go ahead with medications, regular follow-up with the doctors, and take medications regularly so that they keep the other diseases which are there with them under control, like hypertension and diabetes, heart problems, to be taken care accordingly side by side.
And they also, I think, need to be very extra careful with the micronutrients what they are having, especially the CKD patients.
CKD, that's what. If you are restricting all these, when you are taking extra precautions, so if you are going to go ahead on to dialysis, then in those patients, we also even advise them to actually boil the vegetables, dals, everything, and then remove the water out. Remove the water, drain the water out, and then utilize these so that the other micronutrients also are lesser in them.
Definitely. So thank you so much, Dr. Kiran Chandra, for giving your viewpoint on this World Kidney Day Awareness series. As a dedicated healthcare media platform, I think through this initiative, we hope we are able to educate and aware more and more people how to maintain a good kidney health and to avoid kidney diseases. Because as the volume of kidney diseases is increasing, like I just give you a figure, in Western countries, diabetes and hypertension account for over two-thirds of the cases of CKD. In India, too, diabetes and hypertension today account for around 40 to 60% cases of CKD. So all those patients who are already suffering from diabetes and hypertension need to be extra careful, and should be watching out for their kidney health. Dr. Chandra, are there any profiles which they should be, I mean, going on, because as they might be visiting their diabetologists and doctors for their BP thing, so there should be some tests like kidney profile or something which they should be always going on so that their kidney health is monitored.
True. In these, that's what I was trying to point out, that urine protein leak is this first presentation of a kidney disease, and hence urine analysis to look for protein leak. Then
Okay.
urine microalbumin levels or urine protein levels have to be checked, and also the creatinine. Creatinine is a marker of the kidney disease. So it's a waste product which is thrown out by our kidneys. If it is not thrown out, it stays back in the body, and hence any high levels of creatinine indicates a kidney problem. So creatinine and urine analysis are very important to be monitored for all patients who are having diabetes and hypertension.
Yes, definitely. So I hope our audience would be definitely getting benefited from what information Dr. Kiran has shared with us. This is a very significant information about kidney health, which he has shared with our viewers today. It was a pleasure having you with us at Medicircle. Thank you so much, Dr. Kiran.
Thank you. Thank you. It was a pleasure.